Hello everyone, I am Dr. Somalika and I am practicing as a senior consultant neonatologist and pediatrician at Cloudnine Hospital, Kailash Colony, New Delhi. So often parents would come to us and tell us that our child used to sleep for at least 3 to 4 naps in a day and now refuses to even take a single nap, and the child is probably just 1.5 years or 2.5 years of age. So here I am trying to discuss how much of sleep is actually desirable or is essential for a child in the growing ages. So first, it is important to understand that sleep is extremely crucial. Sleep helps in brain development, it helps in memory formation, it helps in transforming whatever the child has learned or incurred during the day. So it calms the child down and helps in transforming a lot of the learned things into long-term memory. So especially for young children, when the baby is born, a neonate would commonly be sleeping around 16 to 20 hours a day. And during this sleep stage, the brain development is ongoing. So it's very, very important to protect the sleep of a child. We should not be interrupting the sleep. When a child is stirring or getting up for feeding, that is when you should initiate feeding in a child. Otherwise, a newborn baby can sleep even up to 4 to 5 hours at a stretch occasionally. So 16 to 20 hours starting in newborn. Gradually the sleep duration in older childhood, in infancy, would gradually come down to probably 13 to 16 hours a day, of which 10 to 11 hours of uninterrupted night sleep usually a child is able to achieve by the age of 1 to 1.5 years. Occasionally, children who continue to be breastfed may have interrupted sleep in the night. They may want to get up if they have some kind of sleep associations. So those are normal, but usually night sleep duration is at least 10 to 11 hours. Day naps for a child between the ages starting from 6 weeks, by 3 months or so, when the sleep-wake rhythm is more or less established. So beyond 3 months of age to at least till the first year of life, a child would be taking anywhere between 3 naps to 2 naps in the daytime. So these nap windows or intervals can be lasting from somewhere between 1 to 2 hours at a stretch. Again, it is very healthy for a child to nap in the day, and it is important to not try and actively disrupt this cycle. So commonly you would get questions like, should I keep my child awake in the day so that they can sleep better in the night? This is a very common misconception. So when you keep your child awake in the day for very, very long hours beyond what is physiological for your child, for a growing child of a particular age, the child's stress hormones go up and the night sleep becomes even more disturbed. If the child is sleepy, we have to allow the child to sleep. And in fact, developmentally, a child is not ready at this age of 1 till the age of 1.5 years to actually fall off to sleep by himself or herself. So they would probably need some kind of downtime. They would probably need some kind of association or some kind of assistance in falling asleep. And it's absolutely all right to help your child, put your child to sleep. So with that assistance and knowledge, gradually as the child grows older, beyond 1.5 years, the naps can come down to 1 day nap a day with 10 to 11 hours of nighttime sleep. So this is the usual sleep recommendations or requirements. So yes, children do sleep lesser and lesser as they grow older, but making sure that they are napping in the day well into toddlerhood is extremely important. Uninterrupted nighttime sleep with a good sleep hygiene, where they retire to bed anytime, definitely before 10 o'clock, by 7:30 or 8 p.m. So early to bed, early to rise is an old adage which still holds true and healthy to this day.